Ocala's information station, 1370 WOCA.
Ocala.
All right, 5 minutes after 11 o'clock. You're listening to the music. That means that Dr. Riadh Fakhoury is in the studio. Today's Wednesday, April 24th. Just so you know, it's a live show, and the show is on the air so that you can have your questions answered about the things that are bothering you. How many times have you just waited and waited and waited? And that's not good. That's not good. Dr. Riadh Fakhoury will tell you if it's hurting for 3 days or more, go see somebody. Dr. Fakhoury is the chiropractic orthopedist and owner of Fakhoury Medical and Chiropractic Center right here in Ocala, and their location is 1009 Southwest 16th Lane. We'll tell you more details about that later, plus the phone number to his office. But right now, the phone number to call Dr. Fakhoury on the air is the WOCA Climate Control Source Hotline, 622-9622. Let me turn around. I always feel rude when I'm facing this way.
It's okay, Larry. How are you? Good morning.
Good. How you doing?
Good, good. Excited about some interesting questions coming in. It's always so nice when we hear from the audience, and they're so varied. Some people are talking about a shoulder, some people are talking about another disorder. We're going to have questions today. It's going to be exciting.
Yeah, we'll have questions, and I want to make sure that everybody knows, okay, no more calling for the Disney contest. This is now time to ask Dr. Fakhoury questions. We'll do the Disney question again in about 45 minutes. Good morning. You're on the air with Dr. Fakhoury.
That was a Disney
question. Well, maybe
question.
that was a Disney question. Yeah, I'm not so sure. Well, we have this Disney thing going on right now. So.
Good.
Yeah. Well, I could use that to kind of parlay a question. That's one of my big issues. Whenever I go to any theme park, it's the regret that I didn't somehow prepare for that day of walking.
And it happens when we put our bodies under stress. For example, driving an hour and a half, walking for 6-7 hours, standing the whole time, and you get fatigued, you get tired. So the areas of your body where you have problems are the weak links, and it's almost like having a chain. And you can pull one end of the chain and the other end and just stretch them apart, and it's going to be that weak link that gives out. And some people, that weak point is their stomach. Some people it's their head, they get a headache. Some people they get sciatica. Right. Whatever it is that's a weak spot in your body, maybe from a previous trauma or injury or disorder, it comes to the surface and people notice it when they're under stress. It doesn't have to be physical stress, it could be emotional also. So if you're sitting at the desk and you're getting external pressures that are bothering you, maybe another coworker or a heavier load of work than you like, or maybe more hours than your body can tolerate, then that stress is like an uncontrolled energy that's going through your body looking for the weak spot. And let's say that it's right at the base of the skull, at the top of the neck, on the right hand side, and you start to feel it back there, and then you'll say to yourself, uh-oh, and then it starts from there, and it'll radiate usually behind the eyeball, and then maybe even some nausea sets in, and then it's hard to really concentrate and function. That we call a cervicogenic headache or a neck headache, a headache that originates from the atlas, or the first bone of the neck, the first vertebrae right up at the base of the skull, right underneath the base of the skull, and when it goes out of position, irritates the nerves and the muscles there, and that causes that headache. Very, very easily treatable through chiropractic care. We can eliminate that headache so often, so easily, and so quickly.
You've actually described something I have experienced to a T. I mean, that does describe what happens to me. I can never figure out what causes it, though. I don't know that it's...
It can be posture.
Yeah.
Maybe you're in a certain position for a long period of time. Let's say you're sitting in your chair and your friend is to the left and your head is turned to the left, so you're putting the right side under stress as you're looking in that direction, or watching TV. Or sometimes when we sleep, we slip off the pillow a little bit, and that puts a little pressure on there. There's so many different things that could do that. We talked about stress. Stress tightens up the muscles in your body.
Right.
It might not bother your shoulder, your elbow, your back, but it might bother that little muscle at the base of the skull, that suboccipital muscle, and cause it to tighten up. And it doesn't take much. If that muscle gets tight, and that muscle attaches into that atlas to shift it and pull it a millimeter or two, and then the process starts from there.
Yeah, and I can think of an example. When you have to repair something or get to something where you're in a place you're not normally at, like underneath a mixing board or under a car, let's say.
Right.
You know, and it's not something I do every day. I'm not a mechanic. So if I'm trying to do something like that, I do have that circumstance happen to me.
Right, especially when and this happens to people quite often. They'll come in with upper low back or lower mid back pain, sort of right where the rib cage ends.
Yeah.
Where the diaphragm is, where sometimes you get a little Charlie horse in that area. And people will come in complaining of that region being a problem, and 9 out of 10 times it's because of a rotation that they've done. So getting to a part in the car, getting under your table here, for example, and unplugging or plugging something, you twist your torso, and that's a very vulnerable area to rotation. So when people are exercising, they're doing rotation exercises of the torso. Sometimes they come in 2-3 days saying, you know, right down at the bottom of my ribs, maybe about 6 inches from my waistline up, I'm having pain, and it's a stabbing type pain, and it can radiate outward into the rib cage also, and sometimes even restrict the person's ability to breathe freely because your diaphragm's there, so your diaphragm will go into a spasm. Again, very, very easily treated with chiropractic because we manipulate and adjust that bone back into position, take it away from the rib, away from the nerve, and then that pressure and that muscle relaxes so you no longer have that spasm.
The phone lines are open. If you would like to speak to Dr. Fakhoury, it's the WOCA Climate Control Source Outline, 622-WOCA. I wonder how many people can relate to what I'm going to describe happens to me. That doesn't happen very often, but I'll start to move, and it's almost like I can feel a little pebble or a little BB, and then I say, okay, don't keep moving that way. Just go right back where you started from. Do you get that comment a lot? Yeah? All right, let's go to the phone. Good morning. You're on the air with Dr. Fakhoury.
Good morning, Larry. Good morning, Dr. Fakhoury. This is June. How are you?
Hi, June. Good morning. How are you?
I'm doing better, thank you.
Good for you. Great.
I have a question for you. The last condition that you were talking about, is that called costochondritis? And I'll hang up and listen to you to answer that. Thank you, Doctor.
Thank you very much. Thank you. So the question that June says, is that pain a costochondritis? And so we'll break the words down. Costo is a bone, a rib. The costo is a rib, and chond is the cartilage. So actually that's more in the front, where the cartilage, and off to the side a little bit, everybody could feel if they come to the side of their rib and move forward, you feel a little indentation maybe about 4 inches away from your sternum on your rib cage, and that is the connection of the bone and the cartilage. That's the costochondral junction. And so bone and cartilage don't join together very well. They're not materials that mix together very tightly. So rotational movement, as June is thinking, will stretch and pull the rib away from the costral junction, the chondral junction, the cartilage, and cause a tremendous pain right in the about 4 or 5 inches away from the sternum, and it's very uncomfortable. In fact, it's called Tsetse syndrome is another name for it, and it's primarily in women, and primarily in young women that are very active in sports also. So we'll see some females coming in with a lot of sternal pain and a lot of rib cage pain, and that is a costochondritis, or inflammation of the joint between the rib and the cartilage. And it takes a while for it to heal. We can treat it, we can help with that, but it takes a while for it to heal. What we were talking about before, June, was a pain, at least in my mind as I was talking about it, I was talking more about a spinal pain or a back pain that's right around the lower rib cage region, but in the back that can radiate around with the rib. That's more of a subluxation or misalignment of the vertebrae and the rib head, so it causes a rib displacement, it causes discomfort, and that also can be caused by twisting and rotation. So the rib cage is very susceptible and prone to injury with rotational forces, and that's important to think about, because when you go into a gym, or if you get a personal trainer, they may want you to do rotation of the torso. Sometimes hold a weight in your hand, or a bar behind your head, or a broom behind your head, and rotate left and right. Well, that's working that person towards the clinic, because that rotation it could be very damaging to that mid-back region, and if they're having the pain in the spine area, that is more of a problem between the connection of the vertebrae and the rib, or the costovertebral junction, where the rib and the vertebrae meet together. But as June was saying, if it radiates up into the front area, then that's more of a costochondritis, or inflammation of the union of the rib with cartilage, because we have the cartilage in the front.
I'm guessing when somebody has a pain there, they might mistake it for some kind of an organ problem, because it looks like right in the area of your internal organs, right?
Yes.
Good morning. You're on there with Dr. Fakhoury.
Yes, good morning, doctor.
Hey, good morning.
A middle-aged family member has been just told recently that he has arthritis in his spine, and that I was wondering if chiropractic care could eliminate the advancement of that, or eliminate some of the pain, rather than taking a handful of pain pills every day. Is there anything that your specialist could do to help? I know you probably can't reverse it, but at least keep it at bay.
That's exactly right. What's there is there, but we have to try to slow that process down to a more normal wear and tear. And the arthritis I'd like to talk about is the DJD, degenerative joint disease, the degenerative disc disease. Those are the wear and tear type of arthritis, not the inflammatory ones like a rheumatoid or psoriatic type arthritis. Those rheumatoid and psoriatic, and those the lupus and the other ones, the scleroderma and the psoriatic arthritis, those type of arthritis are more due to an autoimmune disorder, and it's an inflammatory problem. So we really can't help with that inflammation. We can relax the muscles and do different things to make that person comfortable. But most people are having the type of arthritis which is a wear and tear arthritis, and that's very easy for us to work with at the office. So what do we do at the Fakhoury Medical and Chiropractic Center when somebody comes in with arthritis from wear and tear? First thing we want to find out, what are they doing to perpetuate that? Because either they've had a previous injury that is showing up as arthritis, or they're doing something wrong that's causing their body to wear out faster than it should, or the mechanics of their body, like one hip is high, one hip is low, so there's a little curve in the low back, so it's wearing that disc and the joint out faster. So we want to get to the source of it, improve the mechanics, strengthen the area, and start mobilizing it. When we start moving those joints, they start getting relubricated, they start coming back to life. So what we do is we slow that arthritic process down, and when we slow that arthritis down, then it's more of a normal wear and tear.
Is acupuncture used in the treatment for that?
Again, with acupuncture, the main thing that I find that it's extremely helpful with is with chronic pain. So it can be very helpful with acute pain also, and when you're joining the forces of the mobilization manipulation to move the joints, and you're doing the acupuncture to bring blood and healing into that area, you're doing a combined effort. And what happens is 1 + 1 = 3. It's a synergistic effect, so you get a lot of benefit from it.
If both your parents have had arthritis and it's in the family, and you're not quite in that situation yet, can you prevent it by going to care for at your facility, or is there anything you can do to kind of hold it back, or maybe stop it?
That's an excellent question, and yes, again, the preventive approach is very good. So if you've had a trauma, you've had an injury, let's say you've fallen and you've hurt your wrist and you've hurt your elbow, if you just leave it like that, then you're prone to have arthritis in those joints, accelerated arthritis, and you're going to have problems in the future. However, if you fall and you hurt that area and you realize, well, it's injured, let me get it to heal and strengthen so I have less problems with it. Come in, let us evaluate, let us treat, let us reduce the inflammation, let us improve the mechanics, and that way you'll have less problems with arthritis in that joint, as opposed to leaving it alone and letting it sort of fester and wear out as time goes on. It's harder to take care of it later. It's easier to take care of it earlier. And a good example of that is if somebody is in an accident or trauma, if they don't want to get taken care of right away and that their car has been damaged, I know that something's happened to them. We'll see them usually 6 months to 2 years later, but by that time the arthritis is already starting to set in. So that's why it's so much better to get it early, address it, take care of it, than wait until it's a problem.
Yeah. Can arthritis set in without any injury at all?
Yes, it can. So let's say that that you work and your job requires you to move an item from a tabletop to a higher level on the right-hand side. So you pick it up and you're putting it there. You pick it up and you put it there. So if you're doing that every day 300 times, then what you're doing is you're using that joint excessively, and because of that, it's going to wear out faster than it should. And arthritis is basically a wear and tear, and that's where you would get the arthritis from repetitive stress injury over a period of time, doing the same thing incorrectly and not distributing the stress over your whole body. Instead of doing that, it would be better to pick it up with both hands, keep it close to your body, move your feet and face the item you're doing, and then raise up with both hands and put it on the shelf. That will distribute the stress and slow the arthritis or the wear and tear down. Yeah.
How young would you see arthritis in a patient, or have you seen in a patient?
You know, we've seen arthritis in young adults now, in children that are 12, 14, 18 years old. Yeah. Because there's the lifestyle is different. The kids are not as active as they should be. Right. When you're inactive, arthritis likes to set into those joints. Activity keeps things lubricated and brings food to the area. The movement keeps things alive. When you're sedate, then you're more prone towards arthritic changes. We see kids that are having the sports are getting more aggressive now, so we see more injuries from sports at 9, 10, 12, 15, and they start to manifest themselves quickly after that. We see children that are playing basketball, softball, baseball, and they're very aggressive on their bodies, so they're wearing joints out faster than they should. And then kids get in accidents and traumas too, and sometimes they're overlooked or ignored, thinking, oh, they'll grow out of it. But then the mechanics are shifted, and that takes its toll later on.
Okay, well, thank you very much.
Thank you very much.
Bye now.
Bye-bye.
All right, I want to mention that you can also ask Dr. Fakhoury a question online. There was one here from Jean. She's asking, Doctor, how long will the relief of arthritis be, I guess, when corrected with chiropractic?
That's a nice question.
Yeah.
So I would say that 9 out of 10 people, when they walk into the Fakhoury Medical and Chiropractic Center and we do some form of treatment on them, whether it's chiropractic and or rehab and or massage, whatever the best form of treatment that would be for that specific problem, they'll feel better. They'll do better. But what I usually tell that patient right up front at the very beginning is that we can most likely get you feeling better, and you might feel 70, 80, 90% improved. However, there's some damage to the spine, and we can't undo that damage. We can make it work better and you'll feel better, but you will need now, because the spine has been damaged and there are some arthritic changes and poor mechanics, and the body will want to go back to its old patterns. You will need to come in maybe every month or 2 months for a reminder to realign everything, put everything back into position, relax the muscles, and that person will then feel better, that 70, the 80, the 90%, pretty much 90, 95% of the time. Once in a while they'll have a little drop. But
that's life-changing.
Yeah, so if we treat somebody and they feel better, and it's because of arthritic changes, wear and tear from old injuries that weren't treated and now they're coming in, yes, we can get them feeling better. But if they don't keep up with a maintenance care because the area's been damaged, then what will happen is that they'll be back in pain again, and usually back into the office within 3 months to start back up again. And this is why one of the things that I tell patients and when I'm out in the community speaking is, if we take care of a problem, if you're in a trauma, an accident, injury, take care of it early, then you have a much better likelihood that it's going to heal and resolve, and you won't need to come back to our office later on. As opposed to let it go until it's an old problem, then you'll probably need to come in every once a month, every 2 months to maintain it.
Wow, that is really life-changing. Somebody who could have arthritis relief. I wanted to mention that if you did want to write a message to Dr. Fakhoury on the little message thing on the video, you can't do it at WOCA.com. Go to WOCA.com to start, and then click on the Ustream underneath Dr. Fakhoury's at the bottom of the video that you're watching him on, because that'll take you to the Ustream page where you can type in your questions. And also you can call in, which is the WOCA Climate Control Source Hotline, 622-WOCA. And Doctor, you have a caller right now. Good morning, you're on the air.
Well, I'm glad you explained that, because I was trying to contact you through the email, but now I'm on the phone. I wanted to ask what there's so many cons and pros with the supplement chondroitin with MSG and
MSM?
Yeah, MSM and glucosamine. That.
Yes.
And I'm wondering what your opinion is on it, and if it is affected, how long do you have to take it, and how much do you need to take for it to find effectiveness?
Okay, very good.
And I'll hang up and just listen.
Thank you very much.
Thank you.
Thank you. Good question, because supplements can help, but the right supplements, because you don't want to put money into something that's not going to be useful for you. So at the office, at the Fakhoury Medical Chiropractic, we have glucosamine sulfate. It's pure glucosamine sulfate. So when you take the capsule, 100% of it is a patented form of glucosamine sulfate, which absorbs 98% in your body. Chondroitin is what you usually get in the over the counter. You'll get half the pill is glucosamine and half the pill is chondroitin. The problem with chondroitin, it's a very large molecule, so you absorb less in your body. The average absorption of chondroitin is 0 to 13%, so we'll average it about 6%. So a half of that capsule, let's say the capsule is 500 milligrams, so 250 milligrams, you're only absorbing 6% of the chondroitin of that. So it's just, if you do the math, you're about 15, maybe 15 milligrams of the 250s going into your body. That's why I like pure glucosamine sulfate. It's much higher absorbed, and it's documented where the chondroitin isn't. It's documented to show how it helps the lining of the joints and helps with the regeneration of those joints. And usually when you start taking it, you'll need to give it about 3 months to start really feeling the change. Because remember, with a supplement and something natural in your body, it's a slower process to start seeing the change. For example, patients might come in and they want a natural anti-inflammatory. That, I explained to them, will take about 2-3 days before you start feeling the relief of it, because it takes a while to get into your system. And how much? 1,500 milligrams is usually a good amount, which is usually 3 capsules, because it's 500 milligrams per capsule. Now, if you're over 200 pounds, you can go ahead and take another and bring it up to 2,000 milligrams of glucosamine sulfate.
Now, obviously, we don't want to self-diagnose. Would you do that? I mean, obviously, we'd come to see you, and you would say maybe supplements would help, or I'm guessing a lot of people don't do that.
That's a good example. Is that a patient came in yesterday? Lovely lady that came in. She came in from close to Palatka, and she was trying to help herself. She was taking a calcium, and she was taking a B complex, and she was taking different items, but they weren't really of high quality.
Oh.
And they weren't specific to her scenario. So what we did is we actually sat down with her, did a vitamin review, made some recommendations, kept some things that she is taking, and changed some other things to a more potent and more effective product.
Oh, wow. And time will tell, huh?
Yes.
In her case.
Yes. So basically, just in generality with her, we gave her something for the inflammation, because her entire body is just inflamed. So we gave her a natural supplement as an anti-inflammatory. We gave her the glucosamine sulfate because she has a lot of arthritic changes.
Right.
She's starting osteopenia, which is low calcium in the bone, works its way to osteoporosis. So we gave her the best calcium that you can get. And then we also gave her a priflavone, which is a bone builder, a natural bone builder. And then also a very high potent B complex, because she's deficient in B complex. So a very highly absorbed B complex, which breaks down in 3 stages. So the last stage is absorbed in the gut, which is the highest absorbency of the B complex, as opposed to breaking down in the stomach.
Do you sell them at the...
We do. We have select items. We don't have a lot of things, but the things that are most critical to the majority of the people is what we have at the office, to make sure that there is the highest quality level of supplementation for the patient. And one last thing that she did take is Optimum, which is a multivitamin that we have. Again, it's a professional formula. It's a vegetarian multivitamin product, so everything comes from plant sources, so you don't get the stomach upset. It's more natural, so you can absorb it. It's not a chemical multivitamin. It's not something made in laboratory. It's something made from nature.
Yeah, which is good. I don't know much about it, but whenever I hear synthetically created vitamin E or anything like that, you always what?
Well,
how do they do that?
It's the same as having a synthetic shirt versus a cotton shirt. You feel the difference. One breathes, one doesn't. One is a chemical and one is natural. So it does make a big difference. And making sure that you're taking the right product means that you're going to do something healthier for yourself, and you're not wasting money also. And where we were talking a little bit about different age groups, I'm going to encourage the listeners, because so many are computer savvy, to go to Facebook and to go to Fakhoury Medical and Chiropractic, like us, so you can view it, and go in. And there's some different testimonials that are in there, and you'll see a few of the young children, because you'll see actually some young children and how they've reacted to treatment, and that's a candid response from them. So I know some of the listeners may be interested in that, and hearing from a patient's perspective what they notice and changes. And many of those patients, the middle-aged and the older patients, are in there because of arthritic changes that are causing pain. Some of them are from trauma and accidents that need some treatment, and then their response to the care.
That's good to know. The resources that we have at our disposal right now are, it's unbelievable how much we have at our, just the information is all out there.
And it's really good, because we had a patient come in a couple of days ago, and they did research on the medication that they were taking, and they realized that one of the symptoms that they were having was a very rare symptom and side effect of this medication.
Oh, wow.
And so now they're going back to their primary care and discussing that with them, because everybody reacts differently. So, being more educated, being more proactive with your health is very important. This is what I like when patients come in, and new patients, and they've done some research and they have questions, and they just need to confirm things and make sure that they're on the right track, and that's a good thing.
And if it's hurting, it doesn't have to hurt. If it's sore, or if you want to prepare for something like a walk through a park, or some kind of a athletic event or an exercise program.
And it's interesting how some people, we talked about the one child that waited 2 years that was having headaches and neck pain, one visit and it went away. So other people might wait years, decades, believe it or not, they're in pain. Like this one lady that we adjusted her supplementation, she's been in pain for years, for decades. And so it's never too late to come in, and a lot of people will sort of assign themselves to the fact that they're going to be in pain the rest of their life, until somebody recommends that they come into the Fakhoury Medical Chiropractic. They'll see the chiropractor, they may see the medical doctor, Dr. Shanawani, but then once we start treating them, the majority of the cases respond very favorably, even if the problems have been there for years. And if patients say, oh, there's arthritis in my spine, I tell them, don't worry about that. We see that all the time. It's not how much arthritis you have, it's how well we can get you functioning and keep it that way. It's almost like a tire that's out of alignment. If we realign it, then you don't worry about what's worn out. You're back on the right tread again, and then you're functioning.
Well, what you do is life-changing for sure, and the information is priceless. Doctor, what is your phone number?
The office number is 351-3413, and that will take you to the front desk, who will be happy to answer any questions that you have. If you have questions on insurance, appointments, coming in and visiting, talking, or just basically leaving your number and having a conversation on some questions you have, feel free to call at 351-3413. And for appointments, we are located on 17th Street. As you cross 441 and go over the bridge, at the bottom of the bridge on the right-hand side, there's a light. That's how you access coming into the office, the Fakhoury Medical Chiropractic.
Very good. Doctor, always good to have you in the studio. Nice to see you every week.
Thank you. Likewise, Larry.
We'll see you next week.
Thank you. Look forward to it.
We'll take a little break and be right back.
Accident, injured, hurting. Pain affects so many of us and keeps us from enjoying our daily routine. This is Dr. Riadh Fakhoury, board-certified chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center. Let me visit with you to answer your questions. Let us help you help yourself on the Head to Toe Care Show every Wednesday, 11 a.m. on WOCA. Again, that's Dr. Riadh Fakhoury, here to help you on the Head to Toe Care Show every Wednesday, 11 a.m. on WOCA, The Source.
Ocala's information station, 1370 WOCA.
Ocala.
In specialty crop news from the Southeast AgNet, we're going to pick back up a series of reports regarding the newest efforts of the Fresh from Florida campaign, as Susan Ardizzi, Director of Marketing with the Florida Department of Agriculture, gives us more details regarding the campaign designed to raise awareness of locally grown fresh from Florida products.
We think it's the beginning of a huge, really broad program where we can engage the citizens of Florida in a groundswell of buy local and show the retailers that it's really important that Florida commodities are on the shelves. Consumers really don't want to buy produce from Mexico or seafood from Asia or any place else, since we know that Florida can supply it.
Nardizzi says the campaign is utilizing both traditional and new media.
Right now we're concentrating on regular network and cable television in the top 10 markets, television markets, and we are also doing online advertising